Hi everybody and welcome to this video on mental health and students. Students often face several challenges. One of the most reported challenges is academic, social, financial and career choice. So what we mean by academic is of course your studies, the academic work that you have to face at university. By social we mean that wherever you come from, being thrust into a university, you come in contact with a lot of people. And for some students, it's difficult to fit in this new social environment. And then financial is very obvious. Students often have financial struggles being at university. And then, of course, career choice. Sometimes a lot of students come with aspirations of what they want to study, but sometimes they're not afforded to study what they really want to, and they make the wrong study or course choice. And that can be very frustrating for students. If we look at some statistics regarding mental illness among students, you'll find that 1 in 4 students have a diagnosable illness during their time at university. In other words, 25% of students will suffer from something like depression, anxiety, etc. 40% do not seek help. In other words, 40% of students suffer from some kind of mental illness, but they are either too ashamed or feel that they can deal with the issue themselves. 80% of students feel overwhelmed by their responsibilities. That means that 80% of you guys will reach a point in your university career where you will feel overwhelmed. And then the last statistic, 50% have been so anxious that they struggle to focus in class. So this just shows us how anxiety provoking being a student can be. And sometimes anxiety can also lead to depression, and that can lead to things like suicide and addiction. So as I've mentioned, the top 4 diagnoses when it comes to students are depression, anxiety, suicide, and addiction. And in this video, we're going to quickly have a closer look at all 4 of these diagnoses. So if we have a look at depression, there's several symptoms that we need to look at. The first one is feeling sad. Now, all of us sometimes have our off days or our sad days, and this is not what I'm talking about. If you're suffering from depression, that means that you're feeling intensely sad all the time. The second symptom is having trouble to concentrate or focus. When you're suffering from depression, that puts a drain on your brain. Your brain doesn't have the cognitive ability to focus or concentrate anymore. And you can obviously imagine for a student struggling from depression and being unable to concentrate or focus, how that has a severe impact on the academic performance. The third symptom is picking up or losing weight. What we mean by that is some people that suffer from depression will not have an appetite, and so they don't eat anymore and they lose weight. The flip side of this is some people who are suffering from depression will start to eat more. Eating is a very pleasurable thing to do, and so it almost becomes a sense of self-medication. So if I'm feeling sad, I become an emotional eater because eating makes me feel good, and that makes me feel less depressed. The next symptom would be slowed thinking or speech. Now, this kind of coincides with when we're talking about a lack of concentration and focus. Remember when I said people suffering from depression, they struggle with their cognitive ability. The brain doesn't function as it should anymore. And so people suffering from depression will tend to talk slower and would also inherently think slower. The next symptom is loss of interest in activities or social gatherings. So often the main way that we can pick up that somebody is feeling depressed is if they don't interact with their friends anymore, if they don't interact with their hobbies or activities that give them interest. And this is usually a very big clue that something is going wrong for this person or that they might be suffering from depression. So, for example, if you're somebody that's very outgoing, you like to go to parties, you like to play soccer, you're part of the debate club, and now all of a sudden you've withdrawn and you've isolated yourself, that could be a sign that you're suffering from depression. And then the next one would be loss in energy, sleeping all the time. This is also a big one when it comes to depression. People that suffer from depression has a very low energy level, and so they simply want to sleep all the time. Other flip side of that is also people that suffering from depression, they just want to forget. They don't want to be awake because when they're awake, they're suffering. So they tend to want to sleep all the time because that is how they forget or zone out and not have to deal with their depression. And then the last symptom is feeling guilty or angry for no reason. Often people suffering from depression would be very irritable and they would be quick to become angry, or they just feel guilty all the time. So, if any of you have ever dealt with somebody who's depressed, let's say they want to sleep all the time, they don't want to engage with other people, but as soon as you approach them and you want to talk to them and you want to help them, they're very quick to become angry. So if we have a look at anxiety, the first symptom here is feeling stressed all the time. Once again, similar to depression, I'm not talking about your normal level of stress. Like every morning when we get up and we're late for class, there's a little bit of stress that we experience because we know we've got to rush and we've got to get to class and we know we're going to be late. But people that suffering from anxiety feels on edge. They feel stressed all the time. The second symptom here is feeling irritated more than usual. Once again, similar to depression, people that are feeling anxious and feeling anxious all the time will also be irritated all the time. So very small things that happens to them will set them off and they'll be irritated or they'll become angry very quickly. The third symptom is trouble concentrating. And as you can see, a lot of these symptoms would overlap with depression. But once again, if you're anxious all the time, if you're worried and stressed out all the time, you don't have the ability to focus or concentrate. Once again, you can imagine what an impact that would have on a student trying to perform academically, but they can't concentrate. The next symptom would be feeling scared or on edge. And I've already touched on that. If you're feeling anxious, in other words, stressed out all the time, you're going to be on edge and you're also going to start to feel very fearful. The world is going to become very threatening for you. The next symptom would be sweating or dizziness. And also, the one after that would be shortness of breath. And the one after that would be irregular heartbeat. And the one after that, headaches. Now, the reason why I'm rambling these off one after another, because these are all physiological symptoms. In other words, things that happen to your body. Now, what you have to remember is when you're feeling anxious, you're on edge all the time. That means your heart is beating faster all the time. So, if you imagine if all of a sudden I had to put a lion in front of you, you would either try to fight the lion to protect yourself, or what most people would do is run away from the lion. But in both cases, whether you're fighting the lion or whether you're running away from the lion, your body is going to respond. You are going to feel, you're going to be sweating and you're going to feel dizzy. You're going to be short of breath. You're going to have an irregular heartbeat. Your heart's going to start to beat faster. And maybe after you've run away from the lion or after you've fought the lion, you're going to have a headache. So, this is what we mean by people suffering from anxiety. It's almost like there's a threat that's placed in front of them and they're feeling anxious or scared all the time. So, hence, their heart beats faster, they start to feel sweaty or dizzy, shortness of breath, They can feel their heart beating faster, and they might suffer from headaches. Another diagnosis or mental illness that students often struggle with is suicide. And I'm not talking about students that commit suicide, but also students that feel suicidal. And this is very important that we pay attention to this because obviously we want to pick up when a student is feeling suicidal, we want to intervene. We want to help that student before they reach the point where they commit suicide. So if we have a look at the symptoms here, the first one is severely depressed and extremely negative. So when a person starts to feel suicidal, that usually foregoes a period in their life where they've already started to feel depressed. And the depression intensifies and they feel more and more depressed until they reach a point where they feel like they need to end their life. And that's why we say severely depressed and extremely negative. A person has to reach a level of severe depression before they feel that they need to end their life. The second symptom would be talk of wanting to die or how you would do it. So, when you interact with somebody who's feeling suicidal, they would often, out of the blue, just tell you that they want to die, they want to kill themselves, or they might tell you how they are going to do it. So, for example, let's say you're walking with a friend down the street, and all of a sudden they say, you know what? I wonder how it would be if I could hang myself. There's a tree close to my res, and it would be so easy just to get a rope and hang myself. Or, for example, somebody might say, you know what? I have these pills in my room, and I wonder if I drink all this medication, all these pills at once, if it would kill me. So that's what we mean by talking of wanting to die or expressing themselves and how they're going to do it. The third symptom would be sudden change in personality and behavior. So remember, we're saying here that a person that feels severely depressed will feel or could start to feel suicidal. And as we said in depression, if you start to feel depressed, you isolate yourself. You are no longer yourself anymore. That's why we talk about change in personality and behavior. So a person that feels suicidal might withdraw themselves from others. They don't want to go to parties anymore. They don't want to play soccer anymore. They don't want to be part of the debate club. They don't want to hang out with their friends anymore. So they're not being themselves. They don't have that same personality and they don't do the things that they usually do. The next symptom would be extreme physical and emotional pain. So, being depressed means that you are in a lot of pain, a lot of sadness. But people that feel suicidal, they often say that I feel very, very sad, but I also feel like my neck hurts all the time, or my shoulders hurt all the time, or my back hurts all the time. So their sadness also manifests physically in their body. Then the next symptom would be avoiding friends or social activities. And I think we've spoken about this when we say a sudden change in personality and behavior. And then the next symptom would be sudden calmness after a long period of depression. So, what I mean by this is a lot of the times, and this is not for every single person that's feeling suicidal, but a lot of the times when somebody is feeling very, very depressed and their friends notice that this guy is just not himself, he's sad all the time, or this girl is not herself, after a long time of depression, all of a sudden they wake up the one morning and they're very calm. And their friends don't know what to make of this because all of a sudden this person is different. They're just very, very calm. This could be a sign that they're ready to take their life. Because what you have to remember is if you're feeling depressed for a long time, it hurts. There's a lot of pain there. It's not a nice feeling. And as soon as somebody decides that they're going to end their life, there's a sense of relief or calmness that comes over them. Once they've decided, okay, I'm going to end my life, that means the suffering is going to end. And so they start to feel calm about their decision. The next diagnosis or mental illness I want to talk about is addiction, which is very common amongst the student population. So I'm sure that all of you have experienced or seen a person that's drunk before. They usually have slurred speech. In other words, feels like their tongue is paralyzed. They have bloodshot eyes and they have impaired coordination. They stumble around. Now, this is not just for alcohol. Somebody smoking weed would show the same symptoms. For example, somebody that's addicted to tic or methamphetamine, they might have bloodshot eyes, but they might talk a lot. So slurred speech would not be one of the symptoms. The second symptom is feeling paranoid for no reason. A lot of people that, for example, smoke weed, once they're on their high, they will start to feel very paranoid, like somebody's looking at them or they're going to get in trouble. And it just comes from nowhere. Also, people that use substances that are stimulants, such as methamphetamine, hunga, nyaope, they would also start to feel paranoid once they're on that high. It's not doesn't apply to everybody, but a lot of people experience this sense of paranoia when they're on this drug. The third symptom would be frequently getting into fights and into trouble with the law. If you're addicted to some kind of substance and there is paranoia involved, you are going to get into fights. People that are on drugs are often very aggressive, and so they get into fights quite frequently. And obviously, if you get into fights, somewhere along the line, somebody is going to call the police. Also, when you're involved with illegal substances such as cocaine or tic, you run the risk of having a run-in with the law, of having a run-in with the police. The next symptom is a sudden need for money. If you have a friend that all of a sudden wants to borrow money all the time, they might be addicted to some form of substance. Because what happens is if you're addicted to some kind of substance, whether it's alcohol or weed or tic, your life in essence stands still. You're no longer productive. You no longer engage in activities to get money, but now you need money for the drugs. And so these type of people will start off borrowing money from everybody around them. And once nobody wants to borrow them money anymore, they'll revert to stealing money because all that matters to them is getting money to buy the drugs. The next symptom would be a need to use more of the substance. So our bodies very quickly build up a resistance to any kind of substance. So you might find, for example, that somebody that starts to smoke weed, they will only smoke one weed cigarette and that would give them a high. But after a year, they might need to consume an entire banky of weed, like let's say 4 to 5 weed cigarettes to get the same amount of high. You also find this a lot with something, for example, like alcohol, where you would have drunk 2 or 3 beers to get drunk. Now you need to consume a six pack and later on perhaps 12 beers to get really, really drunk. And then the next symptom would be physical appearance, especially weight loss and personal grooming. So once somebody has become completely addicted to a substance, like alcohol or tic, for example, they will start to change, their physical appearance would change, they'll start to lose weight. They won't, for example, comb their hair anymore, they don't care about dressing nicely, they don't care about taking a shower or washing their face. So their physical presentation sometimes becomes very, very bad. And of course, as some of you might know, people that are completely addicted to, for example, tic or methamphetamine, they will start to lose their teeth, but they just don't care because all that matters to them is getting the drug and consuming the drug. So if you have a friend or family member that over, let's say, the course of a few months or a year, completely change in their physical appearance, that they don't look after themselves anymore, that could be a sign of substance abuse. And then the very last symptom is a sudden change in friends. Now, this is very obvious. If somebody is addicted to any form of drugs, they won't start to hang out, or they will abandon their normal circle of friends, and they will gravitate more to people that's also addicted to the drug, because now they can sort of share that experience of getting high. The danger of this is that it normalizes their addiction. So let's say somebody that's addicted to nyaope. Now, as the addiction gets hold of them, they no longer hang out with the same group of friends, and now they have other friends that are also addicted to nyaope. And what these people tell themselves is, no, it's okay. It's cool to be addicted to nyaope. It feels good, and other people just don't understand. And in that way, the addiction becomes normalized. So what we have to remember is people suffering from some kind of mental illness will rarely seek help. Remember when we went through the statistics, one of the statistics was that 40% of students never seek help. That's because people feel they can deal with it by themselves, or they feel that there's just no hope and nobody's going to help them. So it's very important for friends and family members to be aware of somebody suffering from mental illness and trying to help them. That is why we are focusing here on approaching a friend. How do you approach somebody that you feel might be suffering from some kind of mental illness? Now, what you have to keep in mind is people don't like to be told that they are sick or what they are feeling or what to do. So you've got to be very careful when you approach somebody, let's say, for example, that's suffering from anxiety. They're already on edge, they're already stressed out. And if you simply approach them and say, like, hey, you've got this problem, you've got this illness, you are sick, you are feeling like this, and you need to do this, their response is going to be a very angry or aggressive response. Remember when we said people suffering, for example, from depression, they're prone to being irritable and aggressive. So if you storm in there and you're trying to tell your friend or your family member what they are dealing with and what they should do, you are not going to get a very positive response. So how should we approach a friend or family member? Well, first of all, be very supportive. Try and listen to them and be very gentle with them. Just try to be there for them. The second point is be patient. These things are not going to change overnight. For example, somebody that's suffering from depression is not going to wake up the one morning or the next morning and just be okay. It is a process. So try to be very patient with them. Very importantly, never ever pressure somebody because you could be making the situation worse. If somebody, for example, is feeling anxious and on edge and stressed out all the time, if you pressure them or you force them to go and speak to somebody or go to a hospital and they don't want to, they're going to start to feel more anxious and more stressed out. So, as I said, never ever pressure somebody in trying to do something they don't want to. So, just as a point of interest, somebody that's addicted to, let's say, alcohol, for example, a lot of the times, if you force somebody to go to rehab, it is usually unsuccessful because they are not ready to let go of their addiction. So you can pressure them or you can force them, but at the end of the day, it's a pointless exercise. They need to come to a point where they want to change themselves. And you can apply that to anxiety or depression or feeling suicidal as well. It's important that we support the person, that we're patient with the person, and that we bring them gently to a point where they realize that they need help. But we cannot force them to get help. The next point is, as I've mentioned, ultimately the choice should be theirs. And that's why I'm saying we need to bring them to a point where they make the decision, where they make the choice to get help. And then the last point I want to make is if you're becoming really concerned um, about somebody, please alert the authorities. If you're staying in a residence, alert the people in charge of the residence, or try to contact student counseling directly. So a good example here would be is let's say you have a friend that's feeling very depressed, but now you've reached a point where this person is talking about committing suicide, about ending their life. In a scenario like that, it would be really important to try and alert the authorities so that they can do some kind of intervention with this person. So I also want to talk about people who are suffering. If you are suffering from some form of depression, anxiety, addiction, or maybe you have some suicidal thoughts, my message to you would be remember, your friends are looking out for you. They have your best interest at heart. They might not go about it always in the correct way, but they have your best interest at heart. So when they try to support you, keep in mind that they want the best for you. The second point is they want you to get better. They want you to be well. They don't want you to keep on suffering from your depression or your anxiety. They want you to get better. And obviously, they are not attacking you. They are not criticizing you if they say, like, why are you in bed all day? Or why do you drink so much beer? It's not a criticism. They're not trying to attack you. Remember, they want the best for you. So when they start to ask you about or point out your negative behavior, they have your best interest at heart. And then lastly, talk to those who are close to you until you are ready to seek help. So what I mean by this is if you're suffering from, let's say, anxiety, for example, if you're not ready to seek help, but your friends are willing to support you, allow them to support you. If your family members want to support you, allow them to support you. Talk to them, explain to them how you are feeling, because this would be the starting point where you eventually reach a point in your life where you say, maybe I should go and talk to a professional person. So I want to end off this video by discussing how do you get help. Let's imagine that you are suffering from some form of mental illness. Your family and your friends have supported you, and you finally decide that you need some help. So, for example, let's say you're addicted to weed. It's caused so much havoc in your life. Your family has raised their concerns, and now finally you're ready to get some help. The first point of order would be to contact a professional. And for CPUT, that would be student counseling. And therefore, it's very important for me that you guys know how to reach student counseling. Now, the first thing that you can do is to email us at student-counseling@cput.co.za. We have a dedicated admin person that manages this email. So once you send us an email saying that you need help, you will very quickly get a response. And from there, the admin person that handles the email will refer your case to one of the psychologists at student counseling. So at District 6 campus, we have 3 psychologists and a social worker. And at Belleville, the same applies, 3 psychologists and a social worker. So there is health professionals ready to help and assist you. We also have a psychologist at Mowbray and a psychologist at Wellington. And here are the numbers for the different campuses. So you can have a look at the numbers, write them down or memorize them, however you feel, put it in your phone. But I want you guys to know if you need help, where to get help. So let's say, for example, you might go through your entire student career not needing help at all, and that's fine. But I want you to know that if you hit a snag in your life, if you start to feel depressed and you just want to be in your room all the time or sleep all the time, it's very important for me that once you're ready to get help, that you know where to get the help. Now, of course, as I've mentioned, this is the way that you can directly contact student counseling. But of course, if you don't have this contact detail or you forget this contact detail, speak to your lecturer, speak to somebody at residence. They all are aware of student counseling and they should know how to refer you to us. And then, of course, the last option is to simply come to our office. Just walk into our office, speak to the reception person, and make an appointment with one of the psychologists or the social worker. So I would also encourage you to familiarize yourself with where on your campus is the student counseling office. Anyway, guys, I hope you enjoyed this video and I hope you found it very informative. And I hope that if you run into any difficulty during your student career, that you now know how to seek help.